you all for coming. Please keep eating and drinking. We did close the doors for noise reasons, but the door is there. You can still get out. We're not trapping you in here. So get more food throughout. We're going to have a fun evening. We're going to do some questions. We're going to make time for some questions as well, and a little more networking at the end. So once again, I'm Dean Merritt. A little bit about myself and MindGrub, and then I'll hand it over to our panel to introduce themselves. Also, before that, I want to give a shout out to two other MindGrubbers in the room. Chris Doran in the back here, who lives here nearby, as well as Chris Airy over here. So it's Chris, if you're wondering. Chris and Chris, easy to remember. So I'm a recovering attorney. Are there any attorneys in the room? Any lawyers? Okay, good. Okay, we can actually have some fun. I don't mind lawyer jokes, whatever you want to tell. I got into legal technology a long time ago and then made the pivot to MindGrub, where we are doing much more fun things in technology than just boring legal systems that I used to have to work with. We're building mobile apps, websites, and we're doing them not only with AI, but we're building AI applications. So we've built AI applications for universities. We recently built a HBCU, a chatbot. And it's a very impressive chatbot. I know that most chatbots are, okay, you got a chatbot on your website. Big deal. Everybody's got a chatbot on their website. This one is amazing. You can tell it what you're interested in majoring, what your interests are. It will build you out an entire 4-year plan telling you how to accomplish that. And then you can go meet with your advisor. The advisors don't have to spend all of their time figuring out what classes you should take, what year. This will do it all for you. Go to any other website of a university and try typing that in, and you're not going to get those kind of results or those kind of answers. We've done a lot of other fun applications. Of course, if it involves data and visualization, AI is involved. We did a fun one with the Baltimore Symphony Orchestra. That's where I live in Baltimore. And we created AI-generated sheet music that the chamber ensemble then played. And we had a great group of artists who really embraced it. I know the art community AI can be scary and it's stealing information and things, but this group, they really embraced it. They really took it upon themselves and played some amazing music. They would play first they played a real Mozart piece, and then they played AI-generated Mozart. And to me, I could barely tell the difference. I love music, but I will not sit up here and tell you I'm a classical music aficionado or expert. And it was just amazing to hear it. And they got up afterward and talked about, well, Mozart would have a little more feeling here or more of a story here. So AI still had a little ways to go. We also created all the art with AI. But it was a really fun project to get the art community involved with. So with that, that's probably enough about me and MindGrub. I'll be here to talk about it more, or you can ask the Chris's. Let me hand it over to our esteemed panel here and let them introduce themselves, and then we'll make time for some questions. You want?
All right. Yeah.
You guys?
I think it might be wired in.
You're wired with her, so
okay.
To hear the room, you got to do that.
All right.
Well, it's nice to see many of you again. I think we were in the same room, Dean, maybe 4 months ago, something like that. So I'm Sean Harrison. I'm the Chief AI Officer for a company called Essentra Health. And Essentra is actually based up in Tysons Corner, Virginia, though I live about, 400 yards that direction. So I had a long commute to get here. And we basically provide the back office for government health care. So we have 43 state Medicaid agencies we work with. We work with CMS, VA, and we do things like claims processing for half dozen states. And we do care management, case management, so it's sort of clinical work with beneficiaries, as well as processing claims, rolling providers in Medicaid or federal systems. So about 3,500 employees, and really we are using AI to make that whole process better and smoother. It's not as exciting as creating music, or images, things like that, but there's a tons of applications where we are using AI today. I'll talk more about it, how we've scaled it, things that have worked, things that haven't, but a tremendous opportunity, and I'm excited to be in the role that we're in and in the company I'm in.
Yeah. I'm Venu Malarapu. Yeah, hello. I'll take this. I'm Venu Malarapu. I'm the Executive Vice President for Global Operations at eClinical Solutions. We are a 450 member company. We do two things. One, we have a software platform that brings all the clinical data that's being collected as part of clinical research together, and then generates insights for decision making and eventually submission to FDA, EMA, so that new medicines can be brought to the patients. The second thing is using that software to provide services to customers. I've been with this company for about 3.5 years, been in this industry close to 27, 28 years, living in Raleigh area for about 20 years. Yeah, it's been an amazing journey in life sciences for sure, because all of us are going to be a patient at some point in time. Sometimes we tend to forget why we are doing what we are doing, but I try to at least remind our teams that there is an underlying, greater cause that we are working for. We have come a long way in terms of use of AI. Automation has been, big all the time because we deal with a lot of data. Yeah, there are some war stories that I can share as well. And it's a perennial process, and how fast things are changing will drive us sometimes crazy, but we need to control that chaos somehow. So we'll talk all about it.
Awesome. Hey, good evening, everyone. My name is Issa Sie, and I am the Deputy Secretary for AI and Policy here in North Carolina's Department of IT. And I've been there for 7 months now. I spent 21 years down the street at SAS, but my job is just to try to get all of your public servants at state government, all 60,000 state employees here in North Carolina, to wade into the AI pool and use AI for not just the benefit, but for the protection of all of our constituents, our citizens, our guests, everybody, right? That touches North Carolina, and to do it in a trustworthy way. For me, it's all about using AI in a way that builds trust, and that's kind of question one for us. But we'll talk more about that in a little bit. I was a little late today because I was trying to give you guys, as the taxpayers, every last ounce of your investment in paying my paycheck. So no, I'm grateful to be doing it.
We appreciate that. Hopefully you guys can just hear me. I'm just going to talk loud. Thank you. I think we're going to have a lot of questions for you tonight, Issa. But let's start off here. We'll go on the line with Sean. Each of you has taken AI from pilot to projects to real operational deployments. What was the first sign that AI could deliver measurable business value, real ROI?
Yeah, can you guys hear me okay? I'll also talk with that. Okay, great. So probably the most interesting application, at least as it relates to Gen AI, because we did a lot of work previously on predictive modeling, traditional ML stuff, but in January of 24, which is going back almost 2 years, right? We did our first Gen AI application for CMS, and it's Medicare, and that is before a lot of people really understood what Gen AI could do, but it was actually a really pretty straightforward use case where we would perform appeals for Medicare patients. So grandmom goes to the hospital, she's a Medicare beneficiary, the hospital thinks she should go home, but you disagree. Well, we as family members can appeal. We can say, no, we think she's not ready to go home. So everybody that's on Medicare has that the individual or their whoever's supporting them can appeal that. And so part of what our company does is the analysis within 72 hours of should you stay or should you go, and that work is done by a physician. But then what happens is they write their determination, and it's cryptic physician speak. It's a lot of acronyms, a lot of medications, and then what would happen is the nurse would get that, and then they'd have to write a letter to the patient, beneficiary, and to the hospital. And so that would take it's about a 9-minute process. Doesn't sound very long. That's what a nurse would do, and these are trained nurses that do this day in and day out. But we do a lot of these. We do like 12,000 a month. And so if you could automate that last piece, it's really value added. Anyway, so we built an application using generative AI, GPT-4 back in back in the old days, and it would about 3 minutes for that nurse to then take those notes, process it through this MedScribe application, and then just review it. And what's interesting though is not so much you can create a letter. I mean, it would generate the letter, but what we would do is generate a letter that was, a 7th grade reading level. Actually, it might even been lower than that. It had to be empathetic to the beneficiary, and then it had to be a concise letter to the hospital. So anyways, that was our first scalable use case. We're now at about 400,000 letters that we've drafted over the past 20 months or so, 22 months. And it really just proved that there really is a way to scale AI in the healthcare domain, and in a way where Medicare approved it. They basically let me say this. There's a formal approval process. They gave us the green light. They didn't deny our use of it, and so we were able to incorporate that in our workflow, and it's been incredibly successful.
Great, thank you.
I think, traditional AI, machine learning, that's been around. We have been, using that for maybe 4 or 5 years, I would say. We do a lot of statistical, analysis and programming SAS. It's like, that's part and parcel of what our teams do. But I would say the first time, around the same time, we built a lot of machine learning models using ensemble models and so on and so forth. Then generative AI started, creeping in. I think the first time, if you look at the clinical research process, bringing medicines to market, every day, there's a limited period where life sciences companies have their license, and they spend a lot of money. So the faster they get these to the market, the more beneficial it would be for all their stakeholders. Every day, rough estimate that it is delayed, they say average pharma company would lose like millions of dollars, right? 6 to 8 million was one estimate. So the idea is, how quickly can we aggregate the data, standardize it, and then make it available for the regulatory teams to put it all together and send it across to FDA and such. So that used to take like almost 3 to 4 weeks. And a lot of that was done in a manual way, even though machine learning models were giving a lot of faster results. And that requires a lot of work as well, because we need to train these models, bring in a lot of data, use a lot of studies that have been done, and there is no guarantee that you would get the results that you are seeking. But boy, once we started using RAG with generative AI, it was like amazing, right? So we were seeing almost like 60% faster results. We use Anthropic's models, cloud. That was very eye-opening for our teams. Is like, I can get this thing done, so much faster. So that was a real taste of the power of Gen AI for our teams. And since then, we've been, moving further and further along, I would say.
Yeah, no, thoughtful question, Dean. You ask, like, when was the first time in my current role that I realized just the potential? In government, I think, I can make fun of myself, right? Like, some of the fruit isn't even low hanging. It's just on the ground. You just got to pick it up, right? So being able to say to somebody like, hey, you didn't go to college to manually go through 100 applications in a day. Can I help you with that? Or, and just coming alongside them to show them just how, like, just how much more productive they can be. And so in the case of the person who, had to manually go through 100 applications. Oh, by the way, you had to pick up the phone when the taxpayer calls. Oh, by the way, make time to go visit people, do site visits for these people that you're serving. So like some of that stuff is good, but for me, the first conversation that came to mind was I was talking to these agency leaders about just ways that AI might be able to help them, and you got to meet people where they're at, right? Because some people are excited about it, some people are afraid of it, and some people are both, which is always a very interesting conversation. But in this case, I was saying, the response, I said, well, wow, that sounds like a really in-depth process, really complicated process. Can AI help? And the response was, oh, no, I don't think AI could help at all. It's too complex of a process, and we have like 5 or 6 people who've been doing it for like 20, 30 years each, so like AI couldn't give us any efficiencies. I'm like, okay, that's cool. And I kind of let that go for a couple of minutes, and I came back and I said, by the way, do any of those people plan to retire anytime soon? And the conversation shifted, and about 10 seconds after that, he's like, what do you mean? And I was like, well, can we use AI to capture that knowledge of those people who've been doing it for 30 years so that it's ready for when the next wave of helpers come in? And I mean, very quickly, like we see the value of it, but it's great when the light bulb moment comes on, right? And they see it and they're like, okay, when can I have this? So.
That's great. So we're starting to hear about some of these ideas and projects. That's kind of what MindGrub does, is helping companies take them on their AI journey and get started here. But now we build on that. So when you think about AI at scale, doing this in a bigger fashion, what does that actually look like inside your organizations in terms of people, process, technology? So Isai, you want to continue where your story where you're talking about, like how does that work?
Yeah, for us, and you just have to turn on the news, pick up your phone every morning, go to social media, wherever people get their news these days, right? And you just pick up your device and you just hear all the bad news of all that's gone wrong with AI. So for us, my commitment to our taxpayers and just the state and just the craft of AI is like, hey, North Carolina, we may not be the richest or have the biggest compute centers, but we will have the most trustworthy AI. So for me, when I think about scaling, I like analogies because because it helps me and it helps the people I talk to. But like, if AI is our race car, right? We're going to have the safest drivers and the least accidents in North Carolina state government. Like that is my goal. So for me, scaling that up means that, hey, every project that we do, well, first of all, there's so many problems to be fixed, right? To be addressed. Let's pick the ones that build trust, not the ones that scare the mess out of people. And because what I like to say, and sometimes people, you can see the cynics sometimes when I talk about trustworthy AI, because they're like, okay, trust is just a cute way of saying you're gonna go really slow. Is that right? and my response is usually no. Because the more trust I have with you, the faster we can go, right? Without trust, we're not going to go very far or very fast. If your colleagues don't trust it, if they're worried about you taking their job, they're going to find all the reasons why that piece of AI will not work in their world, right? So that's what that looks like for us at state government.
Go. Yeah, you can look at it in terms of people, process, technology. From a process standpoint, how do you make sure that AI is not getting done outside, but rather becomes part and parcel of the natural or standard process? From a people standpoint, they acquire the skills that would be required where they embrace AI and figure out ways to get things done. From a technology standpoint, as it's changing so fast, making sure that you have ways of scaling up as and when new tech becomes available. But at the end of the day, it's all about delivering the outcomes, right? Irrespective of the business. So how well are you able to use AI to deliver better, outcomes to whoever you're, serving? In our case, patients that are part of clinical research and eventually patients that consume the medicine. So that's how I would define as to how you could operate at scale leveraging AI. You don't need it, right, Sean?
Yeah, well, I'll have to speak as loud. A couple things. So first of all, when we think about scale, it's an internal question first for our employees. Asking the question, how do you do your job without AI, right? And the honest answer now is you can't. There is absolutely no way you can be as effective as a person using AI if you're not. And it doesn't matter if you're in a call center, and we actually do care management for the LIFTS program in North Carolina. So we have a call center of about 60 people that are supporting a North Carolina program, and they are using some of the tools that our team is building. And they're basically getting North Carolina specific documents that are relevant to the people that are calling in, and they're answering them more effectively, more accurately, more quickly. Call times are being reduced. So it doesn't matter if you're writing code and you're using the latest Cursor and Codex tools, or if you're working in a call center. There is just a way that everybody is able and needs to be exposed to using AI. So that's one part of it. The other part of it is how do you get people to proactively use the tools? And we started this group called Elevate AI, and this has been honestly a little more challenging, not getting them to use it, but trying to really figure out if you're using ChatGPT Enterprise across, in our case we have about 350 people that use it. What's the value that we get out of that? And the honest truth is we're not really able to measure that impact yet. We sort of call it walking the dog savings. So employees get the benefit of, and their dogs get the benefit of going out and walking their dog. It makes their time, if they're doing some task, a little shorter. But it's not really, that part yet isn't fallen to the bottom line. That's just sort of elevating everybody's skills, and we're just making them more efficient. And then we have other areas where it's more in the product domain, and it is much more defined. But that's kind of how we think about at least a couple examples of scale.
Great, thank you guys. You guys are talking about some serious stuff here, the people's health care, people's health, the entire population of North Carolina, and keeping them safe. So we're working with a vet group to do basically triage for your pets and going into the vet. So I guess we're animal testing, but no animals are harmed. But you're talking about real people here and involved and things you're doing there. So where are you drawing the line today on autonomy and human oversight? I've heard the Defense Department has policies around this too. Maybe we're all not quite talking about as serious as what they do on a day-to-day basis. But where do you guys draw the line on autonomy and human oversight?
Well, I'll go first. We'll go back down the line quickly. So we've taken the human in the lead, HIL, or human in the loop, and we make it human in the lead. That's sort of our, how we're framing that internally. And we do prior authorization work for a lot of states, and prior auth is a big deal. In fact, it's AI approving or denying healthcare is like the third rail. So if you hit that, you are open. There's lawsuits, there's bad press. So the question is, how do you use AI for a task like that? And we essentially do it in a way where we're helping that clinician, that nurse, get to the information they need to more quickly, more accurately make that determination. So that's a really basic example and an important way that we're using AI. The last thing I'll say on that point is we also work with states. We launched this thing called Safe AI and Medicaid Alliance, SAMA, and it started in January with 2 states, with Washington and Arizona, that are our partners with ours. And since that time, we have 35 states now. So there's a ton of interest, even though there's not always a path. They don't know exactly how they're going to use it. There's absolutely an interest in our state Medicaid partners in using AI. And by the way, could you help with the DMV?
Cool. Given that we are in clinical research, helping patients, patient safety is the biggest concern. So we are not using AI for any decision making, none. Where we are using AI is where it's assisting the stakeholders in making those decisions. anything that touches the regulatory requirements aspect of it, we are not. What we are saying is that AI helps, but human owns the decision. So that's how we are approaching it, and human in the loop is a common way of doing it. So that's how we are looking at it, because as I said, patient safety is of utmost importance, and these are not even drugs that have been approved for consumption. These are still in the development phase. So as such, patients being part of that in itself is a huge risk. They're making a sacrifice in a way to get these treatments to market. We don't want to add any more burden than that on patients and risk their life. So human owns the decision no matter what.
So yes, happy to help fix the DMV. I actually had my first conversation with DMV leadership today. And first of all, just so you guys know, they are working hard, right? DMV, the governor announced to you, like brought in a new DMV commissioner, and they've been working super hard to just modernize. But that was my most important meeting today, and I got the response that I needed and wanted. Yes, thankfully, since you asked about it, but the DMV commissioner said, you know what, those are two high-value operational projects that if we can deliver. So it's like, okay, stay tuned, y'all. Like I don't want to. We're working on it, but yeah, human in the loop. I'm trying to revamp and reframe, the conversation from AI is going to take my job to how about we let AI help you be a better human, right? Like, and so for me, I'm using AI. Again, there's so many problems to fix. So let's start by, I'm picking the ones that build trust so that every state worker can see like, wow, okay, again, I don't have to review these 100 applications manually anymore. Or wow, I have this one person who was saying, I was having a conversation with them, and they said, it's a little scary that AI can just do work so like kick out in 2 minutes, what it used to take me a whole day to write. I said, I feel that. But let me ask you, how many of those do you kick out a day now? And a big smile flashes across his face. He's like, oh, I'm awesome now, right? And so by yes, having a human in the loop, but taking it one step further to saying, hey, how can you re-envision yourself, right? If you didn't have to do these things that you hate. Like if we could afford to provide every employee your own administrative assistant and your own graduate intern, what would you do? What would you have them do? All right, can we start the conversation there? So that's helping shift our culture and our mindset and reframing the conversation.
Thank you. All right, quick question for you, Sean. You mentioned one of your first, this large-scale AI implementation of writing Medicare patients' letters, but you focus not just on speed, but empathy and readability, the 7th grade level. So what did that experience teach you about keeping human context and compassion in automated decisions?
Yeah, I think it takes work, right? There is sort of this natural separation of just doing the task, writing the code, trying to solve the problem in the most straightforward way, and then there's okay, how does this affect the person this letter's gonna go to? So it's really thinking about and making sure that when you're building the application to do that you're remembering who that grandmother is that's getting this letter that might be saying, no, your request is denied, and so that, I think that, and that's less, I think in some ways a technology discussion. It happened before. It's just a matter of, how are you empathetic and how do you have good, user design principles as part of whatever it is that you're building. But you can do it so much faster with AI that you can also be careful to lose it, if you're not conscious of actually trying to build that as part of your process.
Yeah, that responsible AI and the governance process around that is very, very critical. If you are not careful, right, the kind of outcomes that you would end up is something that your business may not want to get into, right? So that's key, and there's like a lot of bias, and the data keeps shifting as well, and then you have to have feedback loops so that it learns. So
thanks. Isa, you introduced the RIDE framework: risk, impact, data sensitivity, and ethics, to help every employee evaluate AI projects. So for agencies or even private companies just starting to mature their governance, how would you recommend they apply that same lens day to day, along those same lines?
Yeah, I didn't mean to come up with an acronym. It just kind of just fell out. But as I'm trying to help the state employees understand, like, okay, there's some. Well, first of all, you meet some employees and some folks who are just like, AI is so new, I don't know what to do. This is so foreign to me, right? And I like to remind them that AI is 90% data. Can we remember that? So all the rules that you had about data, all the rules that you have around security and privacy, like if you just follow those, man, you're 75%, 80% of the way there on the do's and don'ts of AI. But there are some net new muscles that we need to start developing and flexing as an organization around AI. And so I'm asking and I'm training our workforce to start talking about AI projects a little differently, right? So instead of just saying, hey, I got this idea for an AI project and it kind of does this or that, it's like, okay, so RIDE, risk, risk, impact, data sensitivity, and ethics. So it'll go something like this. Hey, this is a medium AI risk project that is, that'll just hit agency wide, right? Because there's low data sensitivity. And then, by the way, the ethics question, if I just get one, is just teaching everybody to ask, like, who does this not work for? Right? I'm an engineer by training. I was trained that you give me a problem, I give you 5 different possible solutions, you pick the one you like best, and we roll, right? But nobody ever taught me to ask, hey, who does this not work for? And if you don't ask that up front, you'll find out pretty quickly as soon as you flip that switch with AI, because it's that fast and that powerful. But, and I know that's a rudimentary way. I mean, there's some like AI governance black belts in here that would just be like, yeah, but what about AB? And you're absolutely right. But, I'm starting with a framework that every manager can understand to say, you know what, that makes sense. So to the example I gave you, how can an AI project be medium risk when it uses low data sensitivity and I'm just using it for, a smaller group of people? And this is some of that net new that I was talking about, because if I'm using, your publicly available data about you, things that you say on Facebook, right, to be able to qualify you in or out of a government program, I'd say that's not low risk, right? And so that's some of the net new capabilities with AI that we've got to be mindful of, because if you ask a traditional cybersecurity person, they're like, if it's low risk data, I'm good. I don't need to worry about it. It's a low risk project, right? So AI kind of takes it up a notch there.
All right, want to make time for questions in just a minute, so I'm going to move to our speed round. So like one sentence, quick answers. What is one place you won't use Gen AI yet, and why? Well, you don't have to answer why, just one place. And I'm going to steal the easy answer already from you. Plumbing is my answer. Though I already saw some company looking at large commercial scale buildings and increasing efficiencies and flows and all that. Got an answer?
I mean, the last mile, it is clinical decisions. So you've said it, I said it, and it's you can't do it.
Yeah.
And by the way, it's not that it technically isn't workable, or that it might not even be more accurate than a doctor or a nurse and an AI. But it's a policy, it's where is society at, so that's why it's not done.
in my field, no decision making. That's where I draw the line, as I said. So it's not going to make any decisions for you. Yeah. It's going to help you make decisions.
Yeah, my one sentence answer is just where the masses aren't comfortable, right? Not that the technology can't do it, but again, if they're not comfortable with it, they're not going to use it anyway, right? And they won't believe it.
What is a mistake you made scaling AI that others can dodge, or a mistake you made along the way here? A bunch of smart people these guys don't make mistakes, so.
Well, I mean, I'd say change management, right? The AI change management is brutally hard. And so we thought, you build it, nurses are going to, well, actually, at first they didn't like it, but once they got comfortable using it, we'd have all this adoption and momentum, and it turns out that there's just change management problems everywhere. And that's the big one.
For me, it's like making it a technology project. No. And anybody that's looking at it as a technology project or AI for the sake of AI, you're not going to end up in a good place. So
Yeah, so much more than that.
yes, absolutely.
You know, we're still fairly early on in our journey at the state, and so, you know, we've scaled up a couple of them. I think it's just dialing in to, again, you got to meet the people where they're at, and just right now it's a guess of like, hey, I think we need this level of conversation. Sometimes it's not enough, sometimes it's too much, right? And so just trying to always figure that out, because it's not a one size fits all. Every agency, every group has their own risk tolerances and their own different, you know, appetites for things and missions. So.
Good. All right, last speed round question. What's your favorite personal AI use case? While you think, I'll give mine that I did. This is my favorite, but I did it today. My son's sports schedule came out, and they just sent out a PDF. It wasn't in TeamSnap or Outlook, whatever. I couldn't subscribe to it, so I just plugged it into AI, and I said, make me a CSV file that I can put into Google with all the addresses, and out it popped, and I had my whole calendar loaded into my calendar in 30 seconds. Just little things, right? You got a favorite personal use?
Personal use, yeah, the first one that comes to mind is I spent about 2 hours with my daughter trying to figure out, like, okay, these community college credits that I took, you know, which ones of, you know, how will that map to my major if I go to this school, and and so, you know, you run out of like virtual fingers to put in websites, because like, right, it took 2 hours and smoke coming out of my ears by the end of it, and it wasn't until the end of it I'm like, wait a minute, could I just ask ChatGPT? And I did. And it gave the same answer which we arrived at, which was amazing. But, you know, like if I hadn't done the 2 hours of manual work to know that it was the right answer, how would I have known, right? Like if it wasn't hallucinating. So
Yeah.
but that was
good,
a pretty
good
good
for
use,
helping with
good
homework,
validation.
as long as it gives good answers.
I have a ChatGPT agent that runs, and early in the morning when I wake up, looks at all my email, chat history, and all of that, gives me top 5 things that I need to focus on that day. It's work related, but personal.
It gives
Keeps it, yeah.
good prioritization.
So I mean, I use it all the time for pretty much everything. We're renovating our house, so I took the architectural designs beforehand, and I'm like, okay, I want, you know, ChatGPT Pro, you know, Claude, you know, Opus. This is like going back 6 months ago, and I'm like, take these and give me really good ideas. Horrible. It sucked. It was all bad. It was all bad. So that's one extreme of like, you know, taking images or these, in this case they were CAD drawings, right, and trying to have it embellish. And I'll give a HIPAA non-compliant answer. My lovely daughter was, you know, was at the dentist that had an X-ray, and she's having some breathing issues, and the dentist said, hey, you have got your airway is not big enough. And you know, he said it's 3 millimeters. It should be 10, whatever. So I took the image because she texted it to me. I loaded it in, I think it was ChatGPT Pro, and it gave just a phenomenally good description of what the dentist said, and then also some suggested next steps. And then I said, go do it in deep research, and it came back and was like a PhD on what was going on.
Actually, Dean, I have a more fun story. Can I share this?
Please.
So I was sitting at a table at a conference, and as an icebreaker or whatever, they had each table break up as teams, and they had trivia. So they'd flash the question up on the screen, you know, multiple choice answers, and you know, like also the competitive juices come out, right? And I'm just sitting there, just enjoying, just not really participating until somebody at my table calls out like, "Come on, why is the AI guy sitting there not helping?" And I was like, okay. So I pull out my phone, and everybody was already starting to like, you know, Google the answers or ask ChatGPT. But I pull out my phone as soon as that slide comes up, right? I took a picture. I love the multimodal. This is what I'm telling you. The multimodal. I took a picture of it and didn't use any words. I just hit go, and Gemini said B. I'm like, B. So I gave the answer before the question was even done being read. And I did that about 4 or 5 times. They're like, okay, you can go back and rest again. But what was interesting was like Gemini did, like, I didn't need words for that. Perplexity was like, I don't know what to do with this image. Like, what, you know? Because the question was in the picture, right? So that was a fascinating experiment.
Can you beat the AI or the AI guy?
To Sean's point around PhD, it just triggered like, I think it was Eric Schmidt who mentioned like, these are like savants, right? And you have your phone in your pocket,
Yeah.
right? It's like having 12, 13, 15, you name it, right? Or you pick a number, that many PhD scholars sitting in your pocket,
Yeah.
right? So it's just crazy as to where things are. And the GPT engine that you are using today, that's the worst that you can work with. Just think about it. GPT-5, all the amazing things that it's doing, that's the worst we can do as human race. So
5-1 today.
yeah, 5-1
Five,
today.
that's right.
Yeah, 5-1. Yeah.
Do we have anybody with a question? Ready? Oh, we got a couple. This table. Here, I'm gonna take the mic down to that table.
Yeah. No. This is our natural voice.
I'm sorry, my name's Ahmed, Full Stack Science. I had a question about, there's a lot of questions about what you do once you try to implement or take it something to production. But I find that a lot of the issues come in the initial conversation because people are so bogged down in their day-to-day.
Yeah.
They don't have time to offer usually for you to interrogate their workflow. So I have a two-part question to that. How do you engage with people who are so busy and you want to help them get less busy, but they don't have the time even to support, gathering metrics for you or engaging with you about the value proposition, because it is hard to measure, I believe a few of you have said. It's difficult to measure up front, like how much value are we going to add without them actually engaging with you? So how do you approach that sort of engagement prior to pilot project?
Well, I'll go quickly on. So we have more nurses in our company than any other employees. Of 3,500 employees, probably 600 are nurses. And when we were doing our first AI work, it was the AI team, my team, me, others, we were going out talking to these people and trying to sell them on AI. And so over the past couple of years, what's happened is the business, thankfully has said, okay, now my group is now turned into an AI, it's called COE, Center of Excellence, but really a center of acceleration. So it's really a COA. And the businesses have been told, your job is to do things better, faster, smarter, cheaper. And so now the script has been flipped. And so the obligation is really on the business lines to actually begin using AI, to actually understand and get their teams to say, I need help with this problem. And they pull us in instead of us trying to push AI solutions. So I think that's like a maturity and a confidence that in the business that AI can solve problems, and then getting the business leaders really to pull you in. That's different than no state clients, right? That like in some cases, right? That's where the Safe AI and Medicaid Alliance started, to try to grease the skids in state government to try to get them comfortable. And so those are two different clients, but we serve them both in my group.
Yeah. Well, a couple of things that I have used, it's a problem like, people are busy. One incentive that we have used is using technology for that as well. It's like have something on their laptop or desktop, whatever they're using, so that it records all the stuff that they're doing if they don't have time. And then talk about how easy it would be if they were able to achieve work-life balance, right? Everybody complaining about me, I'm working 12 hours, I'm working 14 hours, right? And then the last resort is either you will do this and get AI to help you, or someone else that can work with AI is going to take your job. It's as simple as that, right? I know we don't want to scare them that you're going to lose your job, but if somebody else can do this with AI, then they're going to have the job.
I find that there are two main reasons why somebody can't articulate for me the value of an AI project. The first is it's that their idea is not, like the problem's not painful enough, right? Like sometimes when you start asking and you start digging into it, like if you're not willing to help me figure out how to help you, then the problem's not painful enough. But sometimes it's painful, they just don't know how to articulate the value, and it is hard. And so what we've done is we've put together 6 buckets, right? So it's like, hey, when you fill out and you ask me to help you on an AI project, just from in plain English, like, is this gonna, save us money? Is it gonna help serve the customers better? Is this going to help you do what you do, but be faster, and be more efficient? Like, we're just asking them to give me a general ballpark, right? And then it's incumbent upon us as the, and I try to train my team, like, hey, you're not just the tech team, right? Like, you're the advisor. So it's like, hey, I heard you say it touches 12 people before the citizen gets an answer. Is that right? Okay, cool. So if they could do self-service, that would be right. So walking them down that path, but maybe start by giving them multiple choice as opposed to tell me your pain and tell me what this costs you, right?
Great answers. As the sales guy up here, I tell everybody, everyone is in sales, and you guys just gave like 3 great lessons on sales, like how you got to sell it to people, Go ahead. Another question back there? Oh, right here.
Okay, I'm going to stand up here because I don't want to have my back. Sean was seeing me make all kinds of faces, painful faces, because I just recently led a AI pre-authorization for national healthcare insurer as well. So I feel your pain, Sean. So this question obviously is for all of you because you have different types of stakeholders. But when you were talking about the change management and the obstacles in front of you, what would you say were the adoption barriers for each of your stakeholders, and what did you do to overcome it, or what are you actively doing right now to overcome it? Because I know those clinicians, they're tough.
Yeah, the first, I would say, goes back to those nurses that were writing the letters. There is no way an AI can write a letter that's empathetic, just flat out. They're like, just can't do it. And this, again, this is 20 months ago. This is when, the G and generative AI is generating, right? It can generate. And so it took them till they could see it, till you could show them that it could do that. So one was just, it is almost an education. It's like getting, here's how it works, here's what it can do. I think there's that. And then there's maybe a more challenging problem. And this, we work a lot with the state of West Virginia. And it is very family oriented in state government in West Virginia, and there's a concern that AI is going to take jobs. And so there's a resistance to using AI because there's a concern that, okay, my neighbor and friend is going to lose her job, and that is a more difficult one. And I think that one we have not fully cracked with our own internal employees.
Yeah, that's fair. I understand that.
Yeah, for us, we did it 2 ways. One is the executive buy-in at the senior leadership team level. Is one, they recognize that this disruption is happening no matter what. 2, either you use it to our advantage or left behind, right? So getting the leadership to buy in and embrace it wholeheartedly so that they're able to, kind of trickle it down their teams. For the employees, change is hard, right? Change, like, nobody likes change if they can help it. Make it as much fun as possible. We've done prompt challenges, giveaways, hackathons, and then gamification around pitting one team against the other. Is like, hey, who's going to get this training done faster? So various techniques like that. For mid-level managers, that's where the biggest challenge that we have faced, at least, is my team is busy. I don't have time for this, right? So there we have used techniques where, hey, I'm here to help. The technology can help, and here is how this helps. So it took a lot of prodding and pleading to get them to buy into that. But you have to have a multi-pronged strategy, otherwise it's going to be an uphill task.
Yeah, I think I go back to, I love those ideas, by the way, I'm going to use some of them when I get there. Like, again, I have no shortage of problems in state government to fix, so it's like shooting fish in a barrel for me sometimes, and it's, I try to find the one, you got to meet them where they're at, right? So, for example, if they're afraid of it, then it's, I always try to get to I can think through all my conversations recently, and I always try to get to that point where they're like, when I find that thing that makes them say, how quickly can I have this, right? So now you're pulling me in instead of me trying to force my way in, and that to me is all goes back to just building the trust. But then like we have some that are like, hey, I'm all in on AI, I'm gonna do this thing, and then I have to be the one that pumps the brakes. Like, hey, have you thought about the kind of headlines that would come out if you do this thing? What is the worst thing that could happen? How can somebody weaponize this, right? Like just helping them think through some of that. So it's not just adoption, but it's about, again, like safe and trustworthy adoption, but trying to meet them where they're at, addressing the fear or their hopes, and just getting them to pull you is a lot easier than me trying to push my way in. And maybe they'll say, because I can come in with the governor's office and they'll say, yeah, we'll do this, and again, it'll just fizzle out. So
Celebrating success is another thing. Is like if somebody has done something cool, make sure that everybody gets to know about it, right? So that's also something that we are doing.
Will Mendoza here. I heard the three of you mention empathy, decision-making, trust, elevating people over the technology. From your position as high-level decision makers, how do you think about unintended consequences of the projects that are coming up with such a novel technology? Is it something that is already part of your strategy, or is it something that you're looking into maybe later? Because I think if we're touching so much on the human side, having a pulse on those unintended consequences of especially piloting become later on a bigger issue. So I would love to get your take on that.
Yeah, I would say a risk-based approach is what is the risk associated with it, going back to what Isa was saying earlier, right? And the impact, right? And having a sound governance process, because you can't put, cart before the horses, making sure that you define what risk are you willing to accept and what kind of impact are you trying to drive, and see to it that, again, empathy and, things like that, or ethics, is try and do as little damage as you possibly can, but get the most out of it, right? So that risk impact based, analysis and sound governance.
The only thing I would add is we do these things called AI champions, because there are so many subject matter experts in the business that, like, my team just doesn't have that knowledge or skill. So again, it's back to instead of us pushing ideas, it's them pulling, and then those SMEs, they sort of know where the landmines are more than my team would in terms of the use case. And so that's how we've tried to address that. But it is absolutely governance, it's risk management, it's all those things. But that champion piece does help with really focusing in on those things that matter.
Human behavior is a cornerstone of this generative AI. Have we encountered any embarrassing situations where the text is in a hallucination, and how well the non-tech savvy experts are tuned to detect such thing? Have you encountered that?
So the question was, have we encountered any embarrassing hallucinations from the technology? And what was the second part?
How do non-tech savvy experts who are not tuned to what an hallucination will be, how do they detect it? How do we prepare those?
Yeah. I'll just start, again, in government, we're so deathly afraid of showing up in the news of being bad users of the technology, right? And so we're gonna train everything and test everything and measure everything to the point where we are really feeling really good that it's better than a human before we release it, right? But I'll share with you one hallucination that we found as we were going through one testing. So our treasurer was, I think it was Treasury, they were testing out ChatGPT, and it's like, hey, I have these 100-page audit documents for each county, and wow, ChatGPT can help my people go through that and not have to read all 100 pages for each county. By the way, we have 100 counties, right? But so they started with the one on top, which is Aberdeen, and they're like, and you know, rule number one of AI: always ask it questions you already know. And so they're asking questions about this audit report, like, hey, this thing's doing pretty good. But then all of a sudden it started talking about things in terms of like British pound sterling and the impact on European politics. They're like, what is happening right now? But you know, the thing is, if you go, ChatGPT was trained on the internet, right? So if you go and Google on the internet Aberdeen, it's going to pull up Aberdeen, Scotland, right? And so finding out these nuances of how the technology was trained is important.
For us, it's trust but verify and human in the loop. I'll give you one situation. Hallucination is a given. Anytime you are using generative AI, they're getting better at avoiding that. So we work with almost all the names that you have heard during pandemic that have come out with the COVID vaccines, right? So all those customers. As we were doing a little bit of research, trying to figure out the effects of COVID and looking at are there any longitudinal impacts of using these vaccines and so on and so forth. As the chat went on and on, it reached a point where ChatGPT was talking about the virus starting in the US and the vaccines being found in China, right? It completely reversed the facts, right? So you just have to be vigilant of that and make sure that you verify the facts. And this is we created a policy, acceptable use of AI within the company as well. Don't just ask a question from ChatGPT, pick that thing and respond to your customer, right? Or, take that as a fact. So that's where trust that it's gonna give you the right answer, but make sure you verify. Right? So
I love you
plays a
brought
big
that up,
part.
to trust but verify. And we do that with all of our applications, even our websites. When we build a website, we want to make sure it's getting what the client wants. So we trust and verify.
Yeah.
We're going to do both. We're definitely going to do both there. We had a question right here.
Yeah, I worked in the insurance industry and I was the responsible AI lead and helped assess over 300 AI use cases. When the business comes with this idea of using AI to solve a business problem, the intention is always wonderful, right? They are super excited.
Yeah.
And then there's this governance process. Many people think that it slows the process. But my background is also in the analytical software development and testing. The testing is incredibly important because a lot of the time we can't govern that we don't know. Like if we don't know the risk, how you can build effective guardrails around that. And what I see in the industry is that there is not enough emphasis on this testing, field testing, red teaming, stress testing. AI is really good if you ask a traditional question. How about the edge cases that AI may answer in a way that may offend some people and not benefit everyone in the same way? So I was wondering, in your respective industries, what are some effective guardrails that you have built? Are there any examples that you had found out via testing that you took that into account when you were developing your products?
I'll just do one quickly. So in healthcare, the way you train nurses to do certain tasks, if they're like extracting information from a medical record, there's a process called inter-rater reliability, and it's a reliability metric, IRR. And when you have the gold standard, the well-trained nurse, then you have the new nurse that's being trained. The experienced expert nurse will extract it, and then that's the gold standard, and then the new nurse will come in and that individual will be tested. How close do they get to the gold standard? And you can measure all this. And so we do a similar process for when we do medical record summarization. When we built those letters for what we call MedScribe, we had the gold standards, and then we would measure them using AI IRR and the AI inter-rater reliability. And that was one example of how we did that. So it's very quantifiable, and it's very consistent with how we would train and test a person.
Yeah, we have a product called Illuminate. It's used for clinical data intelligence as you are running clinical research. And we have clinical data managers that are poring over hundreds, if not thousands, of patient data points that are coming in. We introduced this chatbot called Illuminate Assist. What it does is, as you are looking at the data that's coming in, you want to see, hey, has there been any adverse events? Adverse events are basically the side effects of using a drug related to this patient, and it would obviously spit out a bunch of information. How do you trust that, right? That it has. So what we have done is, how it arrived at that result, we asked it to also explain that, and share the query, SQL query, as basic as that, so that people can verify that. And before we even introduced it, we took a bunch of past studies that we have done, and threw it in there, asked the question, go back and cross-check whether that is the right answer or not. And we have a threshold of, hey, as long as it's hitting that 95, 96% mark, okay, you can trust it. But as I was saying earlier, let it help you, but let it not make the decision for you. So we always leave the decision to the humans in the process.
And the only thing I'll add is just, no matter how much you test something, and hopefully we're testing the heck out of it, like you'll always miss something, or even if it's perfect now, like as things drift, behaviors and whatnot, and data drifts, right? Like just have a robust feedback mechanism so that people can feel free and to be able to say, hey, I caught a mistake, right? And so if we can't be perfect, which we can't, then the next best thing is like, how quickly were we able to spot this thing and fix it? And that's how we keep that trust level up, right?
All right, two short ones.
Okay, well, okay.
You got one, Chris?
I got one, Chris, so I wanted to ask you this for a while. So, obviously about Executive Order 24, it's a very forward-thinking thing that you might more see in the private sector. So, but it's great that the North Carolina government is thinking into the future. So, what things within Executive 24 do you think can be adopted by the private sector that maybe they haven't thought of, or maybe they should think of to get ahead, as North Carolina wants to do in the AI race?
Yeah, so from the governor's executive order on AI, there's one thing where we've asked every agency to put in place an AI oversight team. And again, that's not to be overbearing on every agency so we can control them better, but it's actually to allow them the freedom. Each agency, if each of your teams or divisions has their own AI group that knows the business better than anybody and can make the go, no-go decisions on, hey, here's what I think we're ready for. Here's what I think our customers are ready for. Here's what, right? Like, then all of a sudden that I think is a good way to balance, like, hey, how do we keep control of things and an eye on everything and still be able to have the flexibility to do the important things.
All right, last question, thank you.
I was wondering if you could share some of your journey from early startup to prototype development to scaling up to an MVP and then launching your products in North Carolina and beyond. If you could share that part of your journey, that would be great. And how did you do fundraising along the way?
You mean from like the current company or on past startups? Because I've.
The Medicaid one.
Okay.
Approval.
Okay.
AI company.
Yeah. Well, I'll say two things quickly. One is, so the company I'm in right now, I didn't start, but I do have an early stage background and done it in the past. I think I'm going to the difference now is that the way that I started companies previously is so different than the way I would start a company now. I mean, the reality is, the one example I'll simply give, this is a technology company, of course, but if, in the old days, it used to be called SDLC, Software Development Lifecycle, right? And, it's this whole, path from idea to delivery. And now it's called AI DLC, right? And it is, describing really well what the business objective is, and then using these amazing tools that can take that description and go from requirements to design docs to test cases to actual code to actually deploying it on AWS, doing the test on AWS, and then here's your website. Then it'll build your website, and I mean it is absolutely true. And so now this idea of how do you start a company and how would you do it? Well, it looked nothing like what I did before, and it's a little bit scary about, are people going to lose jobs because AI is going to take their jobs? Well, the fact is, yes, they will, and there's like an insane amount of opportunity for people that just have a good idea. And now it doesn't take a ton of money. You don't have to go raise gobs of capital. You can actually make amazing progress really quickly with the AI tools that are now available.
Yeah, well, we've been in business for about 13 years, so and I haven't worked for a startup, so I can't speak to that. But one thing that we strive for, because we have this really successful software, when you look at some of the AI native applications and being developed and are getting valuations of $1 billion in just 4 weeks, right? Maybe even less than that. But I think the trick is, and you don't need a lot of software engineers today, right? With vibe coding and codecs and a lot of that. We are trying to adopt some of those, but the key is, I would say, is picking the right problem to solve for, and then making sure that you have the domain expertise to understand that you are solving the right problem, and then being able to show the outcome. That's what I would say. And every success that you see, most of those, unless it's a pure play tech kind of AI native company, most of them are have been on the business side. They're domain experts. They're not AI experts. They're using AI to solve a business problem. I think that's the key. I don't know. Isa, if you have any stories to share.
No, I don't think. Not from a startup
We're not startup guys.
From a
State startup.
Yeah.
Well, I feel like what I'm doing at the state is a startup, right? I got a blank canvas. I got a small, very nimble team, and for us right now, we're pitching our idea, and people are biting, and so I feel the pain of a startup, but I don't have that.
Okay, it's not AI DLC, it's AI DMV. That's what we want.
That's right.
That's great. That's great. Everybody has to act like a startup these days. And I think we created an AI labs department in our company. Everybody's using it, but we had to create an intentional way of doing that. So to use that, using our AI labs team to create AI applications, or just simply helping all of our company to use AI better in all the things they do. Thank you, guys. Let's give our panel a big round of applause. Thank you so much.